Hi, is this Dale?
Yes.
Hi, my name's Emily. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Dale Johnson, 1/1/96.
All right, thank you. I'm going to be doing your head to toe exam today. Is it okay if we go ahead and get started?
Sure.
Okay. So I'm going to start by assessing your head. Any history of headaches?
No.
Any recent head injury?
No.
And any trouble swallowing?
No.
Okay. And do you wear a helmet when you're riding bikes, doing any outdoor activities like that?
Yes.
Okay. So first I'm going to inspect and palpate the skull. Skull is normal cephalic, no bumps. Next I'm going to inspect and palpate the neck. The neck is supple, non-tender. Any pain while I'm doing that?
No.
Okay. And then next I'm going to palpate your lymph nodes, the submandibular. They're soft and mobile. Next I will palpate the trachea. Trachea is midline, non-deviated. And next I'll palpate the thyroid. Can you swallow for me? Good. Next I'm going to be assessing your eyes. Do you have any difficulty with your vision?
No.
Any discharge from your eyes?
No.
And I see you wear eyeglasses. Do you follow up yearly with that?
Yes.
Okay. And do you use eye protection when necessary, like sunglasses or goggles?
Yes.
Okay. So first I'm going to test your near and far vision. So I'm going to give you this chart. I'm going to have you cover one of your eyes with your hand and then read it for me. And then I would have him read it closer and then switch and do it with the other eye. Far and near. Okay. And then next I'm going to do the confrontation test. So I'll have you cover your right eye. I'll cover my same eye. And then tell me when you see my finger.
There.
Okay.
There. There.
Okay. And switch. Tell me when you see my finger.
There. There. There.
Good. Next, I'm going to check your pupillary and corneal light reflex. So I would darken the room in real life. So I'm going to have you just look at me. Good. And then follow my finger. The pupils are equal, round, and reactive to light and accommodation. And then I'm going to just have you follow my finger with just your eyes. Don't move your head. Good. So next we're going to be assessing your ears. Have you had any earaches recently?
No.
Any hearing loss?
No.
Any ringing in your ears?
No.
Do you use hearing protection when you're in a loud environment like a concert?
Yes.
Okay. So I'm just going to inspect the outer ear. There's no excessive discharge. Any tenderness when I'm palpating?
No.
Okay, that's good. And then I'm gonna do the whispered voice test. So I'm just gonna have you tell me if you can hear me. Tell me what voice or what word you hear.
Dog.
Cover one ear while you're doing it. Good.
Dog.
And switch.
Dog.
Good. All right, next we're going to be doing the nose and throat. So I'm gonna have you tilt your head back. No discharge from the nares. The septum is midline. And then I'll have you stick your tongue out and say ah.
Ah.
Okay, the mucous membranes are pink and moist. All teeth are present and no discharge noted at the throat. Next, I'm going to assess your lungs. Have you had any cough recently?
No.
Any shortness of breath?
No.
Or do you have any history of smoking?
No.
Okay. And do you try to avoid secondhand smoke when possible?
Yes.
Good. All right. So first I'm going to inspect the chest. I see that it rises and falls evenly upon inspiration and expiration. Also, the AP diameter is normal. So I'm going to palpate. Just breathe normally. Good. And then I'm going to listen to your lungs, so I'll have you turn to your side so I can listen from the back. Take a deep breath. Good. Your lung sounds are clear bilaterally. I'll have you stay like that. I'm just going to perform a few more tests. So I'm going to take a listen. I want you to say the word 99 repeatedly for me. 99.
99. 99.
Okay. And now I'm going to have you go E.
E.
Good. And then I'm going to have you whisper the words 1, 2, 3. Okay. All tests were normal. You can turn back towards me. Have you had, I'll now be assessing your heart. Have you had any chest pain recently?
No.
Any swelling in any of your extremities?
No.
And any excessive fatigue?
No.
And you get your exercise in regularly?
Yes.
Okay. So I'm going to have you lean back against the couch. I would have you be at a 45-degree angle. And I'm inspecting for JVD. No JVDs noted. You can sit back up. I'm going to palpate the carotids. Good. And then I'm going to take a listen to your heart. All right. The rate and rhythm are normal, and S1 and S2 are both noted. So next I'll be doing your abdominal exam. Have you had any changes in your appetite?
No.
Any nausea or vomiting?
No.
Any changes in your bowel habits?
No.
Okay. And do you get enough fiber in your diet?
Yes.
Okay. So first I'm going to have you lay down. I would have his shirt up for this part. I'm going to inspect the abdomen, make sure that it's flat, no protrusions or swelling noted. Next, I'm going to auscultate. There's active bowel sounds in all 4 quadrants. And then I'm going to palpate. Any tenderness while I do that?
No.
Okay, so next I'm going to run a few exams on you. First is the rebound tenderness. So let me know if you feel any tenderness on your right side while I'm pressing.
No.
Okay, so that's negative. Next we'll be doing the obturator sign. So I'm going to have you bend your leg. We're going to internally, externally rotate. Any pain with that?
No.
We'll do it with this leg. Any pain?
No.
Okay, so that's negative. Next we'll do the iliopsoas sign. So I'm going to have you lift your leg. Any pain?
No.
Okay. Any pain?
No.
Good. So that's negative. Next we'll do the Murphy sign. So I want you to take a deep breath. Any pain?
No.
Good. And then I'll have you sit up for the next one. So this is the costovertebral tenderness. So I would feel on the back, hit with my fists. Any tenderness?
No.
Okay, and I'll have you lie down one more time for me. Next, we're going to test for fluid wave. So I would have someone else hold pressure here, but I'll have Dale do it for demonstration. So I would hit on one side and look for a fluid shift. And then for shifting dullness, I would percuss by the belly button and go downward. See if there's any fluid that went down by gravity. You can sit up. Those are negative. All right, next we'll do your musculoskeletal exam. Have you had any pain in your joints or muscles?
No.
Any weakness?
No.
Any difficulty performing your activities of daily living?
No.
Okay. And have you been getting enough calcium and vitamin D in your diet?
Yes.
Okay. So first I'm going to inspect and palpate the joints. Any tenderness?
No.
All right, there's no obvious swelling or deformities. Good. So first I'm going to have you open your mouth and move your jaw. Good. Next I'm going to have you touch your chin to your chest. Lift your head up towards the ceiling. Turn your head side to side. Good. And touch your ear to your shoulders. Good. Range of motion in the head and neck is normal. Next you can follow me. So I'm going to have you lift your arms up and then hyperextend them. Good. You're going to touch your shoulder blades and then put your hands behind your head. Good. And then you can hold your arms out and bring them back in. Good. So range of motion for the shoulders is normal. Next, I will have you flex your bicep for me and extend. And can you pronate your hands and supinate them? Good. Okay. So next I'm going to have you do the Fallon test. So I just want you to do this. All right. It's negative. Next we'll do the Tinel test. So I'm going to take your hand and I'm going to percuss your radial nerve. Next I will have you lie down. I'm going to have you flex your knee back towards you and then straighten it back out. Good. Other leg. Straighten. Good. And then I'm going to have you do this. Bring your knee inward and outward. Good. Same with this one. Good. And then I'm going to have you swing your leg out to the side, bring it back in. Good. And then I'll have you do it with that leg. Next, we're going to do the straight leg test. So I'm going to lift your leg and then have you flex your foot. Flex your foot. Good. Then we'll do the bulge sign. So I'm going to displace the fluid on the inner side of the knee and then tap the outside to check for fluid. It's negative. And then the ballottement sign, I'm going to cup the inner knee and press the patella upwards. It's negative. And then I'm going to have you stand up and bend over so I can check for scoliosis. Okay. Good. It's normal curvature of the spine. You can sit back down. Next, I'm going to assess your skin. Have you had any history of skin disease?
Yes.
And what is that?
Psoriasis.
Okay. Any changes in your overall pigmentation besides
No.
the psoriasis? Okay. Any itching?
No.
Okay. And you perform a skin self-examination at home?
Yes.
Okay. So I'm just going to inspect the skin for the color, texture. There is psoriasis noted on his extremities. The skin feels warm and dry to touch. And the hair is distributed equally on the limbs. And then next we'll do your neuro exam. Do you have any dizziness?
No.
Any history of seizures?
No.
Any numbness or tingling?
No.
And do you regularly monitor your blood pressure to prevent risk of stroke?
Yes.
Okay. So I'm just going to ask you a few questions. Do you know who you are?
Yes.
Do you know where you're at?
Yes.
Where are you?
At home.
What's the date?
4/28/25.
And why are we here?
We're getting ready to go to dinner.
Okay. He's alert and oriented times 4. So now we're going to do cranial nerve 2. We did that earlier, but you can do confrontation for that. So can I have you cover your eye? Tell me when you see me.
Yeah.
When you see
Yes.
me. When you see
Yes.
me. Switch.
Yes. Yes. Yes.
Good. Next we'll do cranial nerves 3, 4, and 6. So you could do the pupil reaction for that. Follow my finger. Pupils are equal, round, and reactive to light and accommodation. And you could also do the cardinal positions. So follow my finger. Good. Next we'll do cranial nerve 7. So I'm going to have you smile, frown, puff your cheeks. Show me your teeth. Good. And close your eyes tightly. Good. Next we'll do cranial nerve 8, which we already tested earlier. Your hearing is appropriate. Okay. Then I'm going to have you abduct your shoulders. Good. You're going to extend your elbows and then pull them back. Good. I'll have you extend your wrists. Good. And then you can show me your fingers. Do this. Good. Next, I already saw you flex your knees, so you're good. I'm going to have you dorsiflex your ankle. Good, so lift it off the ground like that. Good. And then I'm going to just have you walk across the room for me so I can see. And then do a heel to toe walk for me. Okay. Gait is smooth and steady. Next, I'm going to do the Romberg test, so I'll have you stand up and close your eyes and just stand still for me. Good. You can sit. There's no swaying. Next, I'm going to perform a kinesthesia test, so I'll have you close your eyes. Which way did I point your finger?
Up.
Good. Next, we'll do stereognosis. So I'm going to put something in your hand and have you tell me what it is with your eyes closed.
Remote.
Good. And then next, I'm going to draw a letter in your hand. I want you to tell me what it is.
A.
Good. And then we'll check your deep tendon reflexes. So I'm going to have you relax your knee. Good. Good. All right. You're all finished. Thank you.